Hi, I'm John Silcox with the Fairfax County Health Department. I'm here with Dr. Benjamin Schwartz, who's the director of our Epidemiology and Population Health Division. And we're here to give a little bit of an update on our 2019-2020 flu season. We're still seeing widespread flu activity here in Fairfax County in Northern Virginia. And, it's been that way for some time. So, Dr. Schwartz, can you tell us a little bit about kind of how this flu season has gone so far and where we're at today?
Every influenza season is different, and it's been a long flu season in Northern Virginia. We've had widespread activity for influenza for about 12 weeks now, and began the season with one virus called influenza B, and that virus has already peaked and started coming down when we saw another influenza virus, influenza A H1N1, come into our community. Now, this new influenza virus that is affecting our community right now is one that more often affects children and young adults, while still causing most disease among the elderly and people with underlying problems with their immunity.
And is it unusual to have the flu season kind of behave this way, where we have one virus sort of dominating for some time, then we see another virus begin to circulate?
Often we do see a couple different influenza viruses during the influenza season. This year, I think what's been different is the magnitude of disease, and that this looks like it's going to be one of our more severe influenza seasons that we've had in recent years.
And I believe just last week, Virginia Department of Health reported the first pediatric death related to flu in our state. And so it's just another reminder that this is a very serious disease, and we want to make sure people take all the appropriate precautions. And what would those be at this point in time?
Well, it's still not too late to get influenza vaccine, and I know we say that every influenza season, and many people who don't get vaccinated back during the fall, now that influenza is here and now that we have something to worry about, it's perhaps extra incentive to go get your flu vaccine today. Also, people can take everyday actions that will reduce the risk of either becoming infected with flu or, if you're sick, transmitting it to others in the community. And so if you do have a cough or a sneeze, cover it, and cover it with your sleeve. Don't use your hand, where the secretions then could contaminate your hand and you could touch other people or other surfaces. If your hands do get contaminated with secretions, wash your hands. Wash them well. Wash them with soap and water. We recommend for about 20 seconds to make sure you clean your hands thoroughly. And then if you're sick, stay away from other people. Stay home until you're feeling better.
This is probably a good opportunity to remind viewers about what are some of the signs and symptoms of flu. How can they differentiate that maybe from other respiratory illnesses that are circulating this time of year?
Yeah, influenza is a little bit different from the common cold in that instead of just kind of runny nose and congestion at the beginning of the illness, influenza more often will begin with a sore throat, with muscle aches and fatigue, perhaps with a fever, and then go on to develop a cough later. In some people, again, particularly those who are older or have underlying disease, influenza can then become even more severe and cause difficult breathing or pneumonia.
And can you talk a little bit about the role that antivirals may play in helping treat influenza, or at least reduce the severity of the course?
There are antiviral drugs that can be obtained by prescription for influenza, and these drugs are effective at either shortening the course of disease or making it less severe. Influenza antiviral drugs are recommended for people who are elderly or who are at an increased risk of having complications of influenza because of underlying illnesses or deep depressed immunity.
So once again, we're still seeing widespread flu activity in our community. We encourage everyone who hasn't yet gotten a flu vaccine to do so, and to take those other precautions that Dr. Schwartz mentioned, including covering your coughs and sneezes, washing your hands frequently, and staying home when you are ill. Well, of course, flu is certainly the virus that we're seeing dominating in our community right now, and we're seeing a lot of illness still. But there is another respiratory virus that is making a lot of news these days. It's the novel coronavirus, now named COVID-19, which originated in China and has caused quite a few cases of illness there, but we've also seen it emerge in other countries as well. Can you talk a little bit about the situation to date and what's going on with that outbreak?
So COVID-19, the 19 part is because it emerged at the end of 2019 in December. It was first recognized in central China. And since then, about 70,000 cases have occurred in China, most of them in the province around where the disease began, but then spreading throughout the country. And there have been cases of this illness that also have been identified in 25 other countries around the world. Now, the U.S. is one of those countries where we've had cases, most of them among travelers from China. And in addition, we've had a number of cases among people who came off this cruise ship that many of you have probably heard about, where there were multiple infections among passengers on that ship. It's really important, though, to say very, very clearly there have been no cases of COVID-19 that have occurred in Virginia. There have been no cases in D.C. and also no cases in Maryland. So right now there really is a low risk of this disease spreading in our community, as well as a low risk in the United States generally.
And ever since this outbreak has emerged, we've been monitoring it very closely here at the local level in terms of staying informed on what's going on, making sure our healthcare providers know about the situation, and educating our other community partners as well. And we've also been involved in making sure that travelers returning to our community are properly assessed as well. So can you talk a little bit about that process?
Right, so people who are traveling from China to the United States are coming in through one of 11 airports, and Dulles is one of those airports. At the airport, then, they are screened, and their information is shared with the health department in the area where they live. And we at the health department then reach out and contact them and share with them the precautions that they should take to make sure that they are safe, their family is safe, and the community is safe. So the advice that we're giving is if someone travels here from China for a 14-day period, they should stay at home, they should stay away from others, just in case they're infected. After those 14 days, if they're still well, we know that there's not a chance that they would have the coronavirus, and then they can go out and interact with people, with the community, with no restrictions whatsoever.
And again, important to remind our viewers that we have no cases of COVID-19 here in our region, in Maryland, Virginia, or D.C. at this point in time. But we also, will continue to monitor the situation, and as information changes or guidance changes, we'll make sure we communicate that to our residents as well. Mm-hmm. And I think it's also important that we make sure that people don't allow fear to maybe change their behaviors or change how they interact with others.
Mm-hmm. I've been asked by friends if they should be careful about touching products that come from China, or if they should go out and eat at a Chinese restaurant. And I think it's important that we don't let fear govern our actions. Because the risk is low, because we haven't had cases in our area, it's important not to treat people who are Asian or who are Chinese differently than we normally would treat them. And certainly there's no reason to avoid stores, restaurants, products that may be associated with China.
So thank you, Dr. Schwartz, for giving us this great update on both our 2019-2020 flu season and this emerging disease threat, COVID-19, which we've been hearing a lot about in the news. If you want any more information about either of those topics, you can find it on our website, which is fairfaxcounty.gov/health, or you can also go to the Centers for Disease Control and Prevention, which has great information about flu, as well as daily updates on the coronavirus situation at cdc.gov. So thank you very much for watching. We hope you have a pleasant day.